What does your cancer tumor grade mean? In this video, I'm showing you the difference between tumor grade and tumor staging, plus exactly what tumor grade means and how it impacts your treatment and prognosis. Now, tumor grade is different from your tumor stage. It's really important to understand the difference because they have different implications on your prognosis and your treatment. Let me explain stage first so you know the difference when it comes to your diagnosis and treatment. Stage, as you probably already know, describes the size of the tumor and where it's located in the body. How big it is, how many lymph nodes are involved, if any, and if it's spread to other areas of the body, like your liver or your brain. Those are all involved with your stage. For me, because of the size of my tumor, and because it had spread to a nearby organ, then I was considered stage 3 ovarian cancer. But the cancer tumor stage is actually completely different from the tumor grade. The grade of a tumor is determined by looking at the cells underneath a microscope. After the tumor is removed, the cells are actually taken and looked at underneath a microscope by a pathologist and determined how different they look compared to healthy, normal cells. And that's the grade. It tells us how different those cells look when we compare them to what they should look like as healthy, normal cells. Because really, cancer cells are just healthy, normal cells that have started acting inappropriately, and they're behaving badly. They're rebel cells that act in really inappropriate ways. Now, grade is commonly cited as grade 1 through grade 4. Let me explain. If you have a low-grade tumor or grade 1, then the cells of that tumor under a microscope, they look a lot like healthy, normal cells. The cells are very organized, which is often referred to as differentiated, and we see structures within the cells that are commonly present in normal, healthy cells. Whereas grade 4 is the opposite end. When we look at those cells under a microscope, everything looks really different. Not at all like normal, healthy tissue. The cells are really disorganized, and a lot of the normal, healthy structures are not clearly present. Now, grade 2 and grade 3, they're right in the middle. But you can see how grade 4 is so drastically different from grade 1. Whereas staging considers many other different points, like tumor size and spread to other areas of the body or lymph node involvement. But grade is just how the cells look under a microscope. Both grade and stage are important, but different. And it's important to understand the difference between those two. In the Cancer Freedom Program, I've had a breast cancer survivor who had stage 1 cancer, but it was a grade 3 tumor. She mistakenly thought that she actually had stage 3 cancer, not stage 1. Really scary, right? But this was not at all true. Her prognosis would have been very different if she had stage 1 cancer versus stage 3 cancer. This is why understanding the difference between stage and grade can truly impact the severity of your disease. But when you're given the grade of your tumor, you're often given preliminary results and final results. Here's why. Now, the grade that is determined from the biopsy of your cancer cells can be different from the grade that's determined once the tumor is removed. With a biopsy, the grade is often reported as preliminary results. But once the tumor is removed and the tissue is looked at again, a final result is provided. A biopsy is just one small piece of the entire tumor tissue. It gives you a good idea of what the tumor looks like, but of course, things might change once the entire tumor is removed and the entire tumor is examined. At that time, once the tumor is removed, a final grade can be determined because all the tissue has been removed. But how does the grade of your tumor impact your treatment? A lot of people will say that the higher the grade, the worse the prognosis. I want to get into that here to clear some things up a bit. First, let me give you an example. In DCIS, which is a form of breast cancer, we can use the grade of the tumor to determine if you require radiation treatment or not. If you have a grade 1 DCIS, then sometimes you can skip radiation. Now remember, grade 1 is when we look at those cells under a microscope, meaning that they don't look all that different from normal healthy tissues. They're just not rapidly dividing as much as the cells from a grade 3 tumor would be. This means if you had surgery and all the tumor cells were removed, plus your surgeon was able to get clear margins around the tumor cell, then you may not require radiation. You could potentially skip radiation because your risk of having a cancer recurrence in this situation would be relatively low. So radiation just may not be warranted. But in a higher grade DCIS, radiation would be recommended. The thought in a higher grade DCIS is that the tumor cells might be rapidly dividing. So even if you had surgery with clear margins, there might be microscopic cells still present. The radiation treatment would then be used to decrease the risk of a cancer recurrence. Now, since we're talking about radiation therapy, we need to consider another scenario. Let's consider invasive breast cancer, where the patient had a lumpectomy, meaning that they removed the tumor, but they kept the rest of their breast tissue. In this situation, if you had a high-grade tumor, then your radiation oncologist might be more likely to recommend a boost of radiation. This means giving an extra boost of radiation to the area where the tumor was located. Now, let me give you another breast cancer example. If you had invasive breast cancer without lymph node involvement and you had ER/PR positive cancer, then we could potentially use the grade to determine if you needed chemotherapy or not. Again, you may be considered low risk for a cancer recurrence. Therefore, the pain of going through chemotherapy and enduring the side effects may not be warranted in your case. Determining the grade of your tumor would make a massive impact in your treatment decisions and your life. As a cancer survivor myself, I know how impactful chemotherapy is on you, your life, and your entire community. Now, of course, receiving any kind of cancer diagnosis can be anxiety-provoking and life-changing. But receiving chemotherapy for weeks, months, or even years, well, that can significantly change your life. But it's actually more than that too. In some types of low-grade tumors, chemotherapy just doesn't work very well. Chemotherapy works by attacking cells that are rapidly dividing and growing. So if you have a low-grade tumor, then the chemotherapy just may not attack those cells very effectively. The low-grade tumor cells just aren't that different from healthy normal cells, so the chemotherapy just doesn't work as well. But if you were to literally take the same diagnosis and just swap out grade 1 for grade 3, then chemotherapy might be a good option. But let me give you an example in terms of ovarian cancer. The most common type of ovarian cancer is high-grade serous carcinoma. Now, there's also low-grade ovarian cancer, but high-grade ovarian cancer is much more likely to respond to chemotherapy. So even though it's higher grade, which would typically be considered as more aggressive, it actually responds to treatment better than low grade. Now, many people will say the higher the grade of tumor, the more aggressive the cancer is, meaning that if you have grade 3 breast cancer, it's more aggressive than grade 1. And more aggressive, meaning it's more likely to recur, and you're gonna have a worse prognosis. That's obviously very anxiety-provoking for those of us who have high-grade tumors. But I would be careful with that terminology of more aggressive, because it's not necessarily true. Higher grade tumors are more active. So as a result, the treatment strategies are gonna be different. The tumor cells are different, meaning that they're gonna need different treatment options. Okay, but now that you know more about the difference between stage and grade and how that impacts your prognosis and treatment, the next thing we need to dive into is how you can get to cancer-free and stay cancer-free. That's exactly why I'm linking up this next video here on how I personally beat stage 3 cancer. Click the link here. I'll see you in the next video.